Welcome to Shoestring Productions explanation of General Assistance Medical Care program. This is an attempt to explain the ins and outs of the system in a very low-tech way, as you can see here. What we have here on the board is a mock-up of a benefit letter that aid recipients will receive from their county financial worker. This is a program set up for people with mental or physical disabilities that turn out to be chronic, long term. So starting up in the upper left hand corner, you'll see it'll be a county designation, like say Ramsey or Hennepin County for Minnesota. Again, the General Assistance Medical Care designation, this program. People in these programs will have a case number, which is important to remember, a 6-digit number, and you'll see a budget listing for the month. These get sent out every month to the aid recipients and case managers, other social service professionals working with them. This is based on a household size of 1. Now, we have 2 columns. On the left, we have income, or in this case, the General Assistance Grant of $203. And for this example, I'm using a person who has got a rent subsidy or is paying 30% of their income to live in some sort of facility. But we'll get into that a little bit more in a minute here. Again, we're going back to the General Assistance Grant. The amount of this is a standard $203. This is kind of an entry-level point for people who are going to have a long-term or ongoing disability, mental or physical. Hopefully, as their future progresses, they can apply for SSI, RSDI, or SSDI programs and get a long-term amount that will be significantly more than the general assistance. Going over the expenses column, we see here this person is paying approximately 30% of their general assistance benefit for rent. I'm also allowing here $20 for lights. Heat hopefully is paid by the rent. I'm also allowing a $25 expense for a landline phone. A lot of people use cell phones and either have an ongoing monthly minutes plan or buy phone cards as they are available. I'll skip the garbage and water bills. Those usually don't count. Keep in mind also on general assistance, there is a medical copay for appointments, prescriptions, other services you have to factor in, and again this can count up pretty fast. Generic prescriptions usually about $1. Brand name prescriptions are about $3. A way for people on these circumstances to save money is to have their county financial worker act as their representative payee or accountant, basically, or bill payer. County financial worker will act as a vendor to pay the rent and utilities. And this can be a significant savings to a person getting the aid package. They don't have to worry about getting certified checks or money orders. They don't have to worry about stamps and envelopes. And especially if you consider the cost for somebody taking a general assistance check to a check cashing place, there's a fee for cashing the check. They'll sell you a stamped envelope. That's probably about $1. And you have to watch out for the impulse purchases they have there. At the counter, they'll probably have some cigarettes and a lighter they'll sell you for $6 or $7, and before you know it, you've walked out of there paying $12, $15, maybe $20 for the fees plus the cigarettes and the lighter. And that's a major fraction of the $203. Okay, now the other benefit that comes to people on general assistance who have a fixed address or living in a facility, they can be eligible for a food stamp amount, which recently has been raised. It used to be somewhere in the $130 to $150 range. Now I think it's approximately around $170 a month. This can be issued on an EBT or a debit card, which you can use at grocery stores to buy food. And we'll just go down here a little bit more. If you're on a program, the $170 or the full amount is based on a full month. If you get a program and you're in the middle of the month, you're going to get a prorated amount, which will be, say, for a half a month, it'll be like $85 approximately. If by chance you've been overpaid, they will try to recoup the amount and there will be a deduction from that. But generally, we're looking at an approximate amount of $170, again, based on one person. So between the $203 plus $170, you've got $370 some to live on for a month. Not a lot, especially in times like this, although it's never been a lot of money to start with. Important things to remember: when you get these letters, read them, because they'll send you notices where they want you to renew your application, things like that. You'll have your financial worker's name on the bottom of the letter and their phone number. In Ramsey County, you've got a 266 number to call. It is important to have a fixed address or a general delivery post office address, and you've got to get these letters, read them, return any phone calls, or I should say return any requests for information. Let your case manager or other staff you're working with know about these, because if this mail comes back to the financial worker 2 or 3 times after they've sent it out, they're going to figure that you're not around anymore and your benefits get cut. And living on $300 and some $370 a month is not easy, but living on nothing a month is tougher. Anyway, I'm going to post this on YouTube, and I'll invite your comments and questions. We'll try to follow up with some more videos explaining the transition from general assistance to long-term Social Security income and how that can be accomplished. Anyway, thanks and good luck.